All right. Good morning, everyone. Thank you so much for joining us today. My name is Helen Dawson, and as you can see by my lovely background, I'm with the Altarum Institute. We have been working with Team Kentucky since, back in almost a year now, back last summer, in preparation for the public health emergency unwinding, the resumption of Medicaid renewals, and ensuring that we can secure or ensure the least amount of gaps in coverage for Kentuckians. So today I'm going to provide an update on how Medicaid renewals are going and the unwinding of the PHE, as it did end 1 week ago today based on the federal designation of the emergency, and just provide some updates and data points on where we are. So again, welcome everybody to today's stakeholder meeting hosted by Team Kentucky. We are going to be providing updates on the public health emergency unwinding, specific to where we are in the unwinding period, which is May 18th today. So we have begun those renewals for individuals with a renewal due date of May 31st and a renewal due date of June 30th. So we're in process with both of those groups, as well as unwinding the flexibilities that were put in place and ended with the public health emergency that ended on May 11th, a week ago today. A lot of this information may be similar to what you've heard in the past. We've provided updates regularly. We had 3 stakeholder meeting sessions in March in which Senior Deputy Commissioner Veronica Judy Cecil presented our plan and approach and strategies going through the 12-month renewal process. This will just be updates and reminders for some, but new information for others that are joining these updates for the first time or these sessions for the first time. So as you all know, or may know, Kentucky began Medicaid renewal period, and the period is called the unwinding period of handling all Medicaid renewals, May 1st, 2023. And what that means is that the first cohort of individuals or Medicaid members that go through an eligibility have their due date of May 31st, 2023. When planning for this, we were instructed to distribute all Medicaid members requiring renewal across a 12-month period. And this was the renewal distribution plan. But there were a couple priorities that Kentucky decided to put in place. In the first half of this renewal period or this unwinding period, those members that are 65 plus eligible for Medicare are going to go through their renewal. And we are working across the Department of Aging and Independent Living within the cabinet to ensure that they can enroll in Medicare and transition smoothly to that healthcare coverage. Additionally, for this current cohort that's ongoing in June, there was a cohort of around 14,000 members that were getting special circumstances continuances due to the public health emergency conditions that were put in place in March 2020. And so those individuals will be going through their renewal in June. And so that is a priority that is ongoing now. And then looking forward, those individuals that we anticipate to be eligible for a qualified health plan in the state, based on the information in the system, will be going through the renewals starting in July. This is because the state has put into place a couple systems changes to ensure smooth transition and support for those members to continue coverage by transitioning from Medicaid eligibility into enrollment in a QHP through the state-based marketplace. So this is the overall look. There have been cases distributed across the 12 months with consideration on staff capacity and timing beyond just these priorities. So for instance, in November and December, due to both the holidays and the normal special or open enrollment period and staff capacity during that time, we'll have a slightly lower percentage of the Medicaid members going through renewal at that time. However, this plan will allow all individuals on Medicaid now to be renewed before April 30th, 2024. So that is when our period ends. So I ran through these priorities of May and June a little bit, but what the Team Kentucky is really focusing on is ensuring that the individuals that are 65 plus have transitioned to Medicare. So we are working with SHIP counselors, connectors, and agents to ensure that is that there is no gap in coverage for those individuals. For cases that we have not heard back from, so if there's individuals who have received a renewal packet or a request for information, or we have determined eligible for QHP and they have yet to enroll in a QHP, there is ongoing follow-up, outbound calls, ongoing emails and nudges and messaging communications to ensure that we get responses, we receive the information needed to continue or to determine eligibility, and work with individuals to enroll in a qualified health plan or employer-based health insurance that may be available to them. So that is ongoing outreach, messaging, communications, and I have some data points on where we are with those later on in this deck. As a requirement from the Centers for Medicare and Medicaid Services, when the state was planning the approach, there was an instance for baseline data to be submitted to the federal body so that they can understand the situation of Kentucky, the number of beneficiaries that were enrolled that would be going through renewals. And so we submitted this data as of April 28th, 2023, about a month and a half ago, where there were roughly 1.7 million beneficiaries enrolled in Medicaid in March. There were multiple pending applications received from March 2020 to March 2023 that we are tracking. And then we're also tracking the number of Medicaid fair hearings that are pending in March 2023 that we are following up on and supporting. But this is just that baseline snapshot. This report is available on the Kentucky PHE website, which I will be sharing snapshots of and can even switch over in the view later on today as well. But furthermore, we have some updates on data as of mid-May 2023, so just earlier this week. So this is broken down into the two groups that I was sort of addressing before. There are 72,430 Medicaid members that have their renewal due date of 5/31/2023. Of those individuals, there were 22,930 active cases that we are working through. And a lot of those have been completed for May, and they're continuously working. We're doing targeted outreach at this time to make sure that we keep moving those forward. And then the passive cases, we have gone through and assessed those that require a little bit more information and sent an RFI, and those that can be automatically renewed. So this is just a snapshot here. 60% of those passive cases were renewed in May automatically. So that's a great percentage. And our staff and Department of Community-Based Services staff and our contact center staff and connectors and agents are working every single day to increase these numbers of renewals that are completed, individuals that are transitioned to QHP, and those that are worked with to ensure that they can access additional coverage as well. Then on the right hand of the screen, you'll see the number for individuals whose renewal date is June 30th, 2023. And you'll see that there's a lower number of renewals that have been completed, but that is understandable since these renewals started May 1st, not the system triggered these on May 1st instead of April 1st for May renewals. So there's a 60-day renewal window. And at this time, 52% of these cases were passively renewed. But that is, we're seeing progress every single day. These numbers are increasing week by week. We're seeing a lot of members with cases resolved, information submitted, and moving forward towards ensuring sort of the next steps in coverage. Then, as I promised, the outreach to Medicaid members has been ongoing. There are over 40,000 renewal notices have been mailed to these two cohorts. Almost 45,000 requests for information have been mailed. And then we have sent almost 60,000 email messages to members relative to their renewals. So there is a concerted effort to make sure that communications are ongoing. We have tracked numerous cases that are undeliverable due to incorrect address or undeliverable by mail, but we've acted on all of those. There's almost 70,000 outreach calls that have been conducted by the contact center staff, connectors, agents, and DCBS staff as well. And then inbound, we have received almost 22,000 calls related to renewals. So we're seeing a lot of interest in this, but moving on it quickly and getting answers as best we can. The green and blue boxes at the bottom are essentially flagging a number of sort of alerts that are going out to notify members of upcoming renewal, and then nudges that are going out to member that when a response requires additional information or they have not yet responded. So tracking, helping individuals prepare for what is upcoming, and then consistently communicating to ensure that actions that are necessary are being taken. Also, as I've noted before, with the baseline data submitted to CMS, we are also submitting updated reports to CMS on a monthly basis. Again, this is available on the Kentucky PHE website with the link on the screen here, and we can show this later on too. But we're really trying to take a very concerted effort to keep up transparency and to let the public know what's going on and how things are progressing. So these unwinding monthly reports will be uploaded to the website regularly. There's also additional reports available. As I said before, the baseline data report is up there. We'll be sharing monthly data updates similar to the metrics that I just showed on the previous screen. The PHE flexibilities tracker is up on the website too, which I'll be talking about in just a few slides here. And then the initial sort of planning reports that I discussed at the beginning of this session are also available online. So we welcome you all to access those and let us know if you have any questions about them as well too. We're happy to answer or clarify any pieces of those. So what does this session mean for members on Medicaid? And how can we help our patients, our family members, anyone that we're working with? And there's a couple ways to ensure that individuals can transition smoothly. And one of that is making sure that patients know, and Medicaid members, they know how to respond to a notice. There are multiple ways to do so. The forms can be returned by mail to the PO box on the screen with all the requested information filled in. They can also be faxed. However, if you would like to do so online, the member can absolutely update their information on Connect at connect.ky.gov/benefit. They are able to review the benefits and or upload requested information from the RFI. They are able to designate someone to support them in this. And I know it's frequently a question of whether connectors can do so, and that the answer is yes. Connectors and agents and caregivers can support members in uploading this information. They can also call in to Connect or DCBS. The hours and phone numbers are on the screen, but this is dedicated staff available to help answer questions. You can even call in and work through submitting information live with the agent or connector. And so that is an option as well. You can also go in person to find a connector or an agent office or a DCBS office. The hours are on the screen, and there's links to access or to help where to find office on the screen as well. These slides will be uploaded to the website, so feel free you'll have access to them later on as well. So then what should members do if they need help with this? And that's kind of similar to the last slide. A little bit more specific, like if you just have questions, there are people in the community and all across the state that can help. There are connectors and licensed insurance agents available online and by calling. There is also the SHIP hotline or the Department for Aging and Independent Living, known as DAIL, that individuals that are 65 and older can call to learn more about their Medicare options or ask for support in transitioning and enrolling. And then again, the PHE Unwinding website is a great source of information. There are communication materials, there are data reports, there are resources, there's fact sheets that the federal government has put out that you can access there, so I encourage you to go there. The hyperlink on the screen here will take you there, as well as putting in medicaidunwinding.ky.gov. Another part of the public health emergency in the last 3 years that we've been living through has been the flexibilities that were allowed during this emergency. Starting in March 2020, states were allowed to ensure a couple formalities or processes could be changed so that individuals could receive care safely, providers could provide care seamlessly, and just ensure that people could remain safe and healthy through a pandemic. Kentucky put into place a lot of flexibilities across various authorities. That full information is available on the website in the Kentucky PHE flexibility tracker. And that tracker will show each flexibility that was put into place, the decision for its future, and the impacts that will have. However, as you know, the PHE has ended. So there are a couple flexibilities that have ended as of last Thursday. And so providers are going through their revalidations. Currently, there were some changes to the hospital add-ons, the per diems for nursing facilities, and we took away the second presumptive eligibility period in the calendar year. So the public health emergency unwinding is ongoing. So there are some that are in transition period. So we have put into place some extensions on these flexibilities. And so you can see on the screen, there's a couple that are ongoing, and we have ensured that all policy pieces are in place to make sure this is allowed. There were also some that were permanently implemented through policy updates and changes to these plan amendments that were approved by CMS. A couple of those on the screen you can see is that nurse aid applicants are able to still use the I-9 instead of presenting the Social Security card. There was also expanded telehealth regulations that was put into the KAR 3170. And so there's a full list of sort of what Kentucky can do around telehealth for that. Now, this is a change from previously mentioned pieces. In previous sessions, we were awaiting guidance from the Office of Civil Rights on the transition period for healthcare providers to come into compliance with the HIPAA rules. As of early April, we have learned that with respect to telehealth, there is going to be a 90-day or 90 calendar day transition period so that providers and hospital systems and health systems can come into compliance with HIPAA rules with respect to the provision of telehealth. And that will end on August 9th, 2023. There are multiple resources that we have put up on the website to discuss what that means, but it's really just ensuring that the platform that you use is in compliance with rules and requirements of HIPAA. So I encourage you all, if there are specific questions about flexibilities, to access that flexibility tracker and let us know if you have any questions at this time. Last thing I'll say on this is that regarding Appendix K flexibilities, those will not end until November 11th. HCBS flexibilities were given a 6-month extension after the public health emergency. So waiver service providers and waiver participants will be receiving additional information from the state in the coming months about what needs to be planned for and what will change. So keep an eye out for that. There are resources on the public health emergency website for Kentucky that link to specific information for waiver participants and providers if you are interested in learning more at this time. But we are planning to have a webinar this summer to discuss more and take questions and answer anything that might be of concern. Really, this is an overarching look at what is Team Kentucky doing. You've seen a couple of these things through the presentation today, but really want to flag, we have established a lot of partnerships and working together across community organizations. We are working weekly and sending daily reports to our MCO partners to provide information of their members, to ensure that they are able to support outreach effort and communicate to members as renewals are upcoming. The contact center that we have is conducting direct outreach, as long as connectors and agents both taking calls and working directly with members as needed and requested. We are coordinating with multiple providers and associations providing updates just of this nature. We are working with all of our sister agencies to ensure that policies are in place and system changes are tracked and prepared for as we continue through this unwinding period. We are providing, we are tracking that returned mail, as you saw, to make sure that we can follow up on anything that is undeliverable and ensure that additional outreach efforts are taken to alert members of their status and the actions needed. And then lastly, we've developed reports in the CLOCS, or so the Kentucky Level of Care System, and the Kentucky Health Net that allow providers and facilities to access their members' renewal date information so that they can support outreach. This is also available to connectors and insurance agents, and we're making sure that this is shared and aligns with outreach efforts as needed. Just a snapshot here. This is the referenced renewal date information that is in KY HealthNet for providers. But in terms of working with your patient as they come in, what can you do? The pieces that we shared earlier is there are those available calling lines and connectors online to connect with. But the most important thing right now is to make sure we have their correct information and contact information so that we can reach them when it's time for their renewal. They can do so by logging into Connect or calling Connect to update their contact information. And then really it's just ensuring that everybody's paying attention and watching for notices and watching for messages that are coming to let them know that there's their time to renew. And then if the renewal date, when they learn it, to make sure that they act in a timely manner to respond to the information they need and are able to have their case resolved and not be terminated because of lack of information. We want to make sure we're able to get the information needed to continue coverage and not have any transitions in care. transit or gaps in care. There's, as I said, on the website, there is some waiver participant and provider information, but also linked here. There's an FAQ on the flexibilities for Appendix K, as well as some other pieces that were put into place during COVID-19. And then there are nursing facilities and intermediate care facility providers can access the Medicaid renewal report and clocks. There's a guide for how to do this on the website. So encourage you all to look there if you have any questions, and we can share those as well on the website, or they are shared on the website. Here is just a snapshot of the website and the resources. These are different snippets from the page, so it'll look a little bit different, but it is, as you can see on the screen, available at medicaidunwinding.ky.gov. I can take you to the page to show you what it looks like. So on the page, you'll see an introduction and information. So really the focus is to update information as soon as possible. For members that want to know their renewal date, they can access it and connect. We are loading all of the information from these stakeholder sessions, including the presentation slides, the recordings, and we're updating this frequently asked question every time. We will continue to have monthly meetings for the stakeholder group, and so we will update the registration link following today's session for the next one, which will be the third Thursday in June at 11 o'clock Eastern as well. There's also some recordings from the provider informational session we held on April 20th, as well as the plans and reports that I mentioned earlier. And then for each audience, there are specific materials and information. Following the frequently asked questions section, you can see specific information for members, for providers, for waiver participants and providers, for community partner organizations, our sister agencies. And there's also communication materials available here. The state has put them out and they are at your disposal to share with members, patients, caregivers, and understand more information and how to access it. And then there's some CMS documentation for providers as well available here. This is really what we want to kind of end on today, is how to ensure that you stay informed. The website is the number one spot. We will be sharing all information there and all materials there. You'll see the registration for stakeholder meetings. We encourage you to continue to come through to get the data updates and sort of the progress updates from us. But then the best way is to follow one of the social media accounts. That will be the most live information available. It'll be the best and easiest way to access updates or any changes that you need to be alerted to. So we encourage you to follow. You don't have to follow all of them, be the similar information, but definitely check in on the cabinet social media and track information that's coming out that way. So at this point, I am going to stop and take us to the question period. All right. The SHIP counselors are educated in the ESRD population and understand their eligibility. However, we have ongoing daily sessions with the full team, including our partners at Dale that are supportive of the SHIP counselors. And we can ensure that we are tracking for this population too and flag it first thing when we meet again. To Jill's question about case managers still able to use telehealth after August 9th, the answer is yes, Jill, they will be able to, but the requirement is to ensure that that system or platform that is used is compliant with HIPAA. There is guidance on the website to learn more about those pieces. And so I encourage you to look into that. But I think that a lot of this information is going to be coming, and we can support whatever is needed in specific questions about specific platforms. So Dina, I see your question too about, is this the best call to be on for Appendix K updates? And at this time, the answer to that is yes. We are planning updates coming, or planning a webinar to happen in the month of June, specific to Appendix K and HCBS participants and information. So please be on the lookout for that. Those will be promoted again through social media, so I encourage you to look there. And there's a lot of information on the website to access about what we have shared so far. Jill, for the questions about reimbursement, we'll have to take those back. I believe the changes to reimbursement have already been codified, but we'll need to take that back to the full team. So I'm going to look at a couple questions that came in from registration too at this time. And so the first is, how can the stakeholders on this call best assist Medicaid members with their renewals and updating their address and phone numbers and connect? One of the things I think I would encourage first and foremost is to ensure that anybody that will be impacted by this is aware of the situation and aware of the need to update their information in Connect. There are connectors and agents available to help, but on the benefits page, members are able to do so themselves. The caregivers can support, connectors can support, providers and office members can support that updating of information as well. So please ensure you're just working closely with members and making sure that everyone is aware. I know there's a couple questions about the telehealth pieces and what will specifically be allowed for targeted case management or for FQHC pieces, or how they will be reimbursed. Those questions will be answered in additional sessions as we make sure that everything is in line and in place. So continue to submit those questions and we will add them to the frequently asked questions. We'll confirm with the cabinet and leadership and make sure we have the best answers for you as it comes. Another question that came in through registration is about COVID vaccinations and will those continue to be covered? Vaccinations will still be available. The Kentucky Medicaid will continue to cover COVID testing, vaccinations, and treatment with no cost sharing. But we encourage you to look at the Department of Public Health website for any additional information on public health and safety measures related to COVID-19 that will be going forward. But as it pertains to treatment, vaccination, and testing, Kentucky Medicaid will continue to cover that. For income limits, there were a few questions on that, and I'm pulling up the information on resources. So for income information, that will be required in the applications and most likely will be something that is further information is requested when RFIs are sent out. While this will return to pre-pandemic eligibility requirements, the staff that is supporting enrollment and these renewals is well versed in how to support. One thing I will mention is that over the pandemic or the past 3 years, there's likely to have been an accumulation of resources, and Kentucky has extended the flexibility to disregard resources that may have been accumulated during this time. So there's going to be messaging and support in allowing individuals to spend on those resources without impacting eligibility over the next 12 months. Specific questions about that piece of resources can be directed to Connect Hotline or DCBS as well. There is a question that came in about how can health systems or providers pull eligibility information to understand their patients' renewal dates. And understanding patients' renewal dates is available in KY HealthNet and in the CLOC's renewal date report. There are guides on the website of how to access that information, but it is in the patient's benefit information on all systems. Then working with the patient individually and ensuring that their information is up to date and verified in the system is the best approach. Question about flexibilities made under Appendix K being made permanent came in, and the answer is that some will be. Yes, there was multiple sort of evaluations and studies of the various pieces of HCBS over the last 3 years, and so those changes have been put into place and are available on the website in the section on waiver participant information and in that FAQ referenced before. But again, encourage all of you all to be on the lookout for the upcoming sessions on the waiver pieces and Appendix K to ensure that you have the most updated information. Those sessions are targeted for June or early July, so be on the lookout in the social media aspect for that. So those are the questions received at this time. Really appreciate you all taking the time to attend today's session. In future sessions, we will continue to share updates and progress, any additional communication we've received from CMS, but I really appreciate all of the effort that each stakeholder on this call has taken to support members. It is really taking a full team approach, and Kentucky is doing an excellent job of engaging across the state and appreciating everything. Thank you, Priscilla. Is that the cases for May 31st due date are still running. They have an additional few weeks to be processed before any changes to eligibility are finalized. So that is sort of the discrepancy there. So the total cohort was that 72K, but the 60K is what's been processed at that time. And that was even later in date because that report was submitted 10 days ago. Thank you for your support through this unwinding period, and we will talk again in just a few weeks.